Thank you. Mr. Chen?
Thank you, Mr. Chair. And just to continue on Mr. McColman's line of questioning, so we understand from National Defense, from D&D, that currently the drug mefloquine is only prescribed to service women and men if they ask for it. And for the past 2 years, they reported that only 3 people in the armed forces have been prescribed mefloquine. And I'm hearing from you as our witnesses that for service women and men that this drug should not be prescribed at all, given the conditions under which they work and the risk of potential long-term reactions. So when a service woman or man is deployed to an area where malaria is a real risk, would you agree if all other anti-malarial medications are contraindicated, would you consider mefloquine as a drug of last resort for those who might be exposed to malaria?
I guess that's probably for me. Well, first of all, I can't conceive of a situation that would be a very real one where one of the alternatives, Malarone or something of that sort, would not be appropriate. I indicated in my comments that a person, a military person asking for this drug, I think they would have to be misinformed about the risk. And that's very, very unusual. So I think there are alternatives. Now, if there was some circumstance that I can't think of, then I think that, yes, a careful history of the individual, their past mental health, their family mental health, look for risk factors, and careful documentation and monitoring of them, warning them and telling them what they are to do if they have certain acute effects, because the acute effects are a bit of a warning that things are not going quite the way you want. And these drugs quite commonly do have these acute effects.
So, Dr. Sellers, sorry, I have limited time.
I want to make a footnote to this, and that is that there is evidence that women are more susceptible to mefloquine, and I think that was given no mention at all in the Surgeon General's report, yet the literature is fairly clear that that is an additional risk factor.
Dr. Sellers, I just want to clarify. So you are saying that with respect to other anti-malarials, you cannot think of a situation where someone should have to choose mefloquine over those other options?
I think it would be very, very rare. And I've given a way that if you had to, then you would carefully monitor, you'd be able to intervene. And I mean, we know how prescribing and dispensing sometimes can go. It's, take the pill and then that's the end of it. That's not what, and in fact, the Surgeon General's report documents relatively poor attention to actually informing individuals about the risks, documenting what was done, the contraindications and so forth. So there's already evidence that, it's what we would expect in medical practice.
So with respect to prescribing mefloquine, you've said that drug labeling is not sufficient. Patients need to be explicitly warned. How would that be done in a general sense for any doctor that is prescribing this to a patient?
Well, we have other examples of drugs where we have checklists, we have patient information documents that you can provide to them to inform the individuals. You can actually have them sign a contract that they have read it and understand it, explicitly telling them what the risks are and what you're going to do to monitor, bring them back at specified intervals to make sure that they're doing okay. So I can think of a way that you could give mefloquine, except I can't think of a situation where you'd really have to. There are a number of alternatives out there, and there are others that are coming along that will, more modern kind of approaches, vaccines and things of that sort.
I'd like to hear Professor Quinn if she has any comments with respect to my questions.
Yeah, look, I agree with Dr. Sellers. I think it would be a very unlikely and unusual situation that the need for deployment was so high that the use of Mefloquine as a drug of last resort would be advisable or acceptable. The review process would need to occur at least 3 weeks to a month prior to deployment, so that any medical review was occurring in country and not out of country. But look, the likelihood of this situation arising in the light of many, many other alternatives and significantly safer alternatives, I think the suggestion is sort of a moot point.